Today, we're diving into the fascinating world of allergies. We will talk about why it's so important, why so many of them have developed in the last couple of years, and we'll bust some myths about why honey would help. Did I say that right? Why are they becoming more... do you know what? I screwed it up, man. I kind of messed it up. I started so well, though. Do you know what I mean? I was like going for it. But then, hi, guys. Welcome to our, I think, 12th episode now. We're doing really great. We love it here. As you can see, we're trying out intros, and I obviously suck at them. But you know what? We're coming with new intros, and it's going to be interesting.
Yeah, don't give up in life. You know?
Yeah, I was going to say, like, our guest today is Dr. Mayamba. Ooh, ooh. Can we get those? Yeah, can we get those things?
Yeah, we should get
like,
them.
Can we get those?
Like a live mixing set?
Yeah, exactly.
Yeah,
that one's where you clap when I say something great.
I'd abuse it.
Yeah.
I would.
Please. Yeah, so everybody in the comment section, just type Stan. Please do the right thing. He needs to organize the little...
Did anyone get us tickets to Kenya?
No.
For the youth team?
No, nobody got us tickets to Kenya. That is very unfortunate. Nobody's given us anything free except Kalafhi Day Hospital that offers us this platform to record every day.
Thank you, Kalafhi, for the sponsorship.
Thank you very much.
Appreciate you.
Shout out. Yeah, Kalafhi Hospital is in Fairgrounds Mall. Please pop in and you will be met by very wonderful doctors. I've had some great reviews from patients. I myself was a patient here, and this is a very great place.
Quick question, because I don't think we got a catch up. What happened with the hiccups?
Okay, so I got home that day and I drank water. Mm-hmm. Now, you know how I said, water doesn't work, Mm-hmm. It does not.
Set me up.
Basically, you check how you have water like this, né? You drink it from this side. So you put your mouth, your upper lip and lower lip on this side. Then you sort of bend over forward and you drink it. That way you compress your diaphragm and then you drink that water. That everyone's always like, water. And once you do that, right, if you finish a full cup, your hiccups stop. Yeah. So that's what happened, guys, to my hiccups. I'm not sick today. I'm very healthy, and I'm going to be very loud, and I have a lot of not so hot takes. You know what I'm saying? Yeah.
You know, it's like the guy that first had to milk a cow. How do you how do you discover this? Like, how do you discover I must put my lips on this side to, you know, I'm mad at. Imagine I walk in the room and you're there
bending over and drinking the...
No, I'm the diaphragm. I'm compressing it. No. Listen, it worked. So, do that technique. Yeah. I don't know who it belongs to, but clearly it works.
Yeah. We can call it the Michaels technique from now on.
Yeah, we'll call it that.
Hiccups, this is the Michaels technique. I am claiming it. TM on the water thing. I'm very much claiming it. But what you said about whoever discovered milk, I don't even know what sort of obscenities they were doing to that cow.
But like, how did you...
And then what clocked for you to put it in your mouth? Like,
and you're like, let me taste this. This tastes nice. And then package it and sell it. The things we learn.
Yeah.
Today's topic is one that's close to my heart because I'm a victim of it.
Really?
Yeah. Allergies.
What allergies have you got?
I'm asthmatic and I have eczema and allergic rhinitis.
Oh.
And to some other medication, or aspirin, aspirin-induced asthma. Yeah. Can't take Disprin, aspirin.
You can't take Corenza.
I literally can't. I avoid. That's why I personally have like a beef with Corenza.
For real?
Yeah, I hardly ever write it unless like a patient insists. But
wow,
how we discovered, I think I was 12, 13. Mm-hmm. I was having like this nasty headache, just like sensitivity to light. So I tell mom's in the kitchen, yo, my head's still hurting. She's like, okay, go to the drawer. There's Disprin, take one.
Yeah.
I go there, I get one. We're sitting there watching TV, and I'm wheezing, like audible from a distance. And then like she gets frantic. She doesn't really drive. Has a driver's license, but just doesn't like to drive.
Right.
We get into a cab. We get to the hospital. I think my O2 sats were like 60, 70. Man. And I was just chilling. I mean, normal should be 94 to 99. But I was at 60, chilling. And everybody looked concerned in the room because, I mean, I didn't understand what was going on, but like,
That is crazy.
Put me on an O2 tank.
Yeah.
Finished all of it. Hooked me up to another one. I think it went up to like 85.
What, didn't have like what, salbutamol? There was no asthma sprays?
It's then in the history, which is the importance of history, because now the doctor's asking, okay, what happened? Like my pumps weren't working.
Oh.
None whatsoever.
Okay.
So then we figure out, allergy to aspirin.
Yeah.
Which is important for every single patient. Like if there's something that you've observed that doesn't work for you, please tell your doctor.
Be open about it to your doctor.
Rightfully,
Yeah.
the doctor should ask if you have allergies, but
Yeah.
sometimes
Before prescribing even.
you forget.
Yeah.
And it's happened to me a couple of times, I'm human too.
Yeah.
I would forget to ask. And because I would explain the meds, right? They're like, oh, yeah, no, by the way, I can't take Brufen.
Yeah.
I'm like, thank you. That's why I do the whole explanation thing, and you can catch these things. So, allergies.
Do you know that was the one thing that I got wrong in my, I was doing an OSCE. An OSCE is like a structured exam where you get in and then you meet like a fake patient. And then, so during the exam, I do a good full history. I ask, oh, do you have any allergies? She says, yes, I've got penicillin allergy. Do you know I write on the prescription? Amoxicillin. Bro, and you know them ones where you get out of the exam. So amoxicillin is a type of penicillin that you can't give if somebody's allergic to penicillin, right? So you know them ones that you get out of the exam room and you're like, I just fumbled that, didn't I? Yeah, that was one. But then ever since that day, I never forget to ask, yo, do you have an allergy? I think in the history, it's very important.
There's different types, because you mentioned allergy to medication.
Right.
There's allergy in terms of contact. Like some people are allergic to latex.
Yeah.
For example, you have food, which is a classic, peanuts, egg, and you mentioned meds, yeah?
Yes.
Yes, and insects. Like,
and
for example, insect venom.
Yes.
But the one we're going to be talking about today, seasonal allergies. It's getting
allergies.
hot. I hate summer with my life.
Yeah, it's getting hot. And I think we're getting into that sweet, it's a sort of spring where you get in, it's very windy. No, it's not spring. I think it's autumn then in that case. Yeah, it gets windy and there's a lot of like dust and things flying around. So a lot of people are coming in. We're going to get a good influx of, I was about to say good influx of business, but we're going to get a good influx of patients coming in with allergy and allergic symptoms. So could we start off with Dr. Mayamba educating us? What on earth is an allergy? And I'm going to tell you a very interesting thing, Doug. Okay, I'll start it. I'll just say it now. So I recently developed, so I've grown up with zero allergies because I'm Ndebele.
Right.
And we're generally a good breed of people with no allergies.
We heard you the first time.
Oh, you heard me? Okay, cool. Yeah, so if I wasn't Ndebele, I'd probably have had a lot of allergies. But yeah,
Fair. Rub it in, one true.
But I've recently developed this thing where if you scratch me, right, I get hives.
Njay, like just any...
Bro.
That happens with me with our dogs, though. Like when they lick me, I just break out in hives. Only our dogs, which is weird because...
Other dogs are fine.
Yeah, they'll lick me and it's calm. But like, bro, I would literally like get to the parents' house. If I'm wearing shorts, it's a movie. Lick me, and then it's just hives everywhere. Till today, I don't know.
You've been rubbing hydrocort when you get inside the house.
I literally move with it in my pocket.
Shame, man.
Literally. But to answer your question, let's start with defining.
Yeah, what an allergy is.
Well, let's get like into like a little history.
Okay.
So it's first introduced 1906. I'm going to butcher this guy's name.
Right.
He was an Austrian pediatrician, Clemens von Birke.
Yeah.
Something like that. But he's an Austrian pediatrician.
Right.
In his clinical work, he observed that kids tended to have an exaggerated reaction to vaccines.
Okay.
And upon realizing this, he combines two words, allerg and gern. Allos and geron.
Geron, right.
Yes. Allos just means strange or weird or abnormal.
Okay.
And then the last one would mean reaction. So then allergy comes up together as abnormal reaction. Okay. So to explain this strange reaction kids were having, that's where the word allergy came from.
Oh, okay.
But in simple terms, it just means hypersensitive or increased sensitivity to regular, harmless stuff like dust or pollen.
Right.
So, for example, if I have an allergy, yes, I have increased sensitivity to something. I can walk in a room with somebody, dust does nothing to them, I start sneezing.
Yeah.
You could have peanuts and you be okay because I'm sensitive to them. I break out.
You break out somehow.
So classic symptoms. Would you like to tell us?
Classic symptoms involve, the first one is hives or the skin reaction, where, I don't know, your skin just starts to look weird. You have this rash and it's bumpy and it gets itchy sometimes. Some people, it could get like it goes from really mild to really, really bad. So the scratching, maybe the sneezing, and then some people it triggers another disease in them. So some people will get that asthmatic reaction that Dr. Mayamba got with Disprin, right? And then with some people, it gets really bad where they have something called, it's coming.
Does it start with the letter A?
It does start with the letter A. Oh, come on, man. You're going to do that to me and then just leave it there.
N?
It's anaphylaxis. Sorry. So you get anaphylaxis. That's really bad. That's
Life-threatening.
Yeah, it's life-threatening. It's when your throat is closing. Your blood pressure could drop as well. It gets really bad. And then you have to see a doctor in the emergency room. And speaking of this, I have to say this. I had a patient the other day. He was having a bad allergic reaction. It wasn't quite anaphylaxis yet, but like he's sitting there wheezing, but he's a man, right? There's a line in the clinic, it's about 5 people. And you can tell that he's struggling to breathe. So I do this new thing in the clinic now where after I serve one patient, I'll walk with them to reception so I see the next one. I see this guy is sitting there in distress, man, and he's like, he just walked in. And I'm like, okay, first of all, say it. Like, I can't breathe so that we can help you fast, right? Exactly. And then I take him into the office, look at his throat, bro. There's like this much left. There's literally this much left. Yeah, so I grabbed the adrenaline and then I went and jabbed him. And then I monitored him for some time. I gave him we've got an oxygen thingy at the clinic now. It's about 10 liters, not too great, but it helps, right? Because it's a clinic. And then I gave him some hormones as well. He stabilized and then he was much better. But like, just say it. You know, if you get to a clinic and you're having a really, really bad, I know everybody's sick and you're trying to respect them, but if you're struggling to breathe, man, don't be a man about it.
Yeah.
Just say, look, I'm not feeling well. But yeah, I drifted, sorry. But then, yeah, those like the classic symptoms of allergies. Yeah.
So classically, like you mentioned, there's the itching, the hives, the sneezing, and in horrible situations, well, you just basically get swelling. Let's simplify it. The skin swells up, your throat swells up, your nose swells up, your lungs swell up, your airway swell up, you can't breathe, and the likes, right? Now, in terms of we know what it looks like, before we get to management, because I'll leave that for you, in terms of diagnosing it, what's your experience with allergy tests? I'll tell you mine. Great, but not accurate.
Yeah.
After my Disprin situation, I had a skin prick test that was done.
Right.
Turns out I'm allergic to cockroaches.
Yeah.
And cow dung, which I've been around and nothing happened.
Which is also not relevant to your situation.
Exactly. And there's so many people that would come in and it clearly looks like allergies, right? Send to do an allergy. Because the thing, it's your immune system, right? Because now the question becomes, what's the cure and treatment, and which we'll get into. But as long as you're alive and your immune system's there, it's going to be hypersensitive to these things, right?
Yes. Yeah.
So you want to avoid the triggers. If you know dust not your thing, like stay away from
the dust.
Dusty places.
Right. Don't have a big carpet with you. You know what I mean?
Now, it looks like allergies, like you know it's allergies. You send for the test, comes back negative.
Oh.
So like in a clinical setting, you know, sometimes patients do come in and be like, no, I came in to do an allergy test, this.
Yeah.
Not just from clinical experience, like from personal experience as well. Like, you know how many roaches I've like just swatted and nothing happened.
Right.
Then my dogs lick me and
you get hives, and no one's gonna think to test your dog's saliva and be like, what's in there that's causing it?
So I encourage a proactive observation method. Right. So like, especially with parents, like observe, like when we use this lotion, this happened. When we did this happened. So let's avoid this, avoid that, avoid this, avoid that. Yeah. Because the tests it's not like gonna just give you everything. Right. Especially in our setting with limited tech. I mean, in higher ends, sure, they can get it as accurate as possible, but observation is really your best. Yeah. Yeah. I think my situation in the clinic is always somebody will come in like, oh, I have allergies and I don't know what it is. I want to do a test. I'm like, cool, let's try to do it.
I don't like the way the results come out because they bring a long list of things that the patient is allergic to, and so they're not so specific. At least the way that we have them right now. It's a bit boring to have to explain to a patient. Like in your case, somebody came in, it's Disprin. We know it's Disprin. You took Disprin, you had breathing problems, right? Now you're telling them cockroach, insecticide, grass, pollen, and all of that, right? When all these things, like now you kind of, you're limiting the quality of life of the patient.
Yeah,
I mean,
literally.
if you've been on grass, you haven't reacted, or if you get like a small reaction, ferment. You know what I mean? But like, obviously, if you can't breathe and you're in Poland, don't firm it. Do you know what I mean? Come to the hospital and get help. So yeah, there's that. That's my experience definitely with
How would you?
the tests.
You actually did mention it, but how would you treat an acute allergic reaction?
Okay.
Like let's say I come in as your patient. I tell you, there's this tree at work across, and every time I step out for lunch, I start sneezing and my nose gets blocked.
Right.
How can you help me?
Don't go to that tree. Don't go to the tree. I wrote a letter one time for a woman. She was complaining that at work, the carpet in one particular room was giving her hives.
Yeah.
And she would sneeze and all that.
And you sound crazy to other people.
Yeah. And I wrote a letter and I was like to her boss, change her office. Because she went to her boss and was like, I'm allergic. I can't work in here. And he was like, piss off.
And what's mad is if you were to try and quantify that, you need a test.
Exactly.
Like, for example, someone needed like walking aids, like crutches, right? If I was to justify, let's say the company paying for this, I would need to prove that I need them. Like, let's have a broken bone. Here's my x-ray report. Now, someone comes in and tells you, hey, listen, mate, this carpet of yours, this particular one makes me sneeze. How? It's hard to like convince
an employer
that this is actually happening outside of like a clinical setting.
Yeah.
So I'm hoping the employers watching, be nicer to your people, man.
It is tough, man, and it's tough because sometimes, and a lot of times, you can't actually disclose the patient's diagnosis.
You can't.
So I can't say take her out of the office because she's allergic to the carpet. I'm going to say due to her medical condition, she can't work in this environment, and then they have to push her out, and then that's it. So it's a bit tough. It gets a bit tough, but yeah.
Me and my blocked nose.
That's how. Okay, you've got a blocked nose again by the tree.
I hate the fact that you said that answer because it's true.
Yeah, that's the answer. Like because people, like a lot of people will be like, oh, Allergies, and then I don't know, Flomist, right? But you're not avoiding the trigger. And this is the same people that will come and be like, oh, doctor, you're not treating the root cause. The root cause is stay away from the tree. Right, because that's what's giving you the reaction. So that's the best way to go about it. Obviously, if you cannot avoid it, and obviously if you've got to a point where your blocked nose is now bothering you, and it's like it hasn't gone away since you moved away from the tree 2-3 hours ago, then yes, I will give you a medication for it, right? And maybe like a nasal spray as well to help, right? But generally, avoid triggers. That's the key. Avoid triggers.
You can already answer the question. Steroids and antihistamines.
Antihistamines, yes. Yeah. Those are mainly the drugs that we use to treat. And then in anaphylaxis, we use a very interesting drug called adrenaline. Tough one. But yeah, we use that one. And I think there's a time Dr. Mayamba and I were traveling to Swaziland. And we actually had a girl that had an allergic reaction at the mall.
Oh, yeah.
Yeah, we had a girl with an allergic reaction at the mall. So
before you go on with this story,
yeah, go on then.
I've always like growing up and watching TV.
Yeah.
And like you're on a plane and then something happens and they're like, is there a doctor? And
Yeah.
I was used to ask myself like through med school, I was like, bro, what happens if this is me? Like,
yeah.
And then it happened at the mall.
And it happens at the mall, yeah. So we're, do you want to narrate it? Oh, okay.
No, go ahead.
And eat it up. So we're walking inside a mall in Johannesburg. No, there was Pretoria.
Yes, Pretoria.
Right, on our drive to Swaziland. And we passed by a shop. It was an H&M. And there's a girl on the floor. And there's people panicking about and just walking around. So Dr. Mayamba and I look at each other, right? And
Probably
we're
look at
like,
each other, we're like,
obviously we have to go and help
Yeah.
because we're medical professionals. We took an oath, right? But at the same time, we don't have license to practice in South Africa. So anything
Yep.
that we do to help is goodwill. And obviously we can't charge for it because we're not authorized to practice there. So we run there and then we're like, hi, listen, we're medical doctors. We're going to check you out. No stethoscopes, nothing, man. I see Dr. Mayamba putting his head on her chest to try to listen for wheezing and things like that. He's checking her airway and things, and I'm lifting her legs to try to increase blood flow and things like that. And then we're telling everybody, call
The ambulance.
an ambulance.
Which was such a hard thing to do as
Which
well.
exactly is so tough. But then I realized something when I was going back, because when we went on our drive back, I was trying to think about how we could have managed that situation better. And the reflection was, in an emergency situation, if you're going to go and help, right, the best thing to do is not call an ambulance. It's you call an ambulance. So you appoint at one specific person, you've given them that task, right? That's their responsibility. If you just shout, call an ambulance, everybody could just assume, oh, you know what, an ambulance has been called. But yeah, we're there for about 15 to 30 minutes. She did get better. She had lost consciousness for a bit, and then she came back. And then the medics arrived, and then we gave them an update. They took her, and then she went away. And I guess one day, if our podcast gets famous and she watches this episode, we hope that you're alive, and we're happy to see you. I guess
iron deficiency, actually.
Yeah, exactly. Yeah, exactly. There was an iron deficiency as well in that case. Yeah, so that was really cool. But yeah,
which is fun because the next episode is about everything first aid and emergencies.
Oh, sweet.
And I mean, like you said, basic 101 is call for help.
Call for help.
As soon as you get there, as soon as you can, call for. I think it's nice that you put it that way. Like assign somebody to do it versus just
shouting it. If you just blurt it out, it's not going to help. It's really not going to help. All right, are we going to do a fact versus myth?
Yeah, I have an interesting fact.
There's a couple ones. Yeah,
I have an interesting fact.
Let's do it.
There is a very rare type of allergy.
Right.
You won't believe to what? Water.
To water.
Yeah, aquagenic urticaria.
Right.
This could be like sweat, tears, rain. Like just break out in
Can
hives.
they drink it? Because it's giving rabies. It's giving rabies. If you can't drink it, it's because you die.
So my thing is, because I'm thinking now, how are you managing this person? You can never cry. You can never be out in the rain.
How are you giving them a drip?
You can't shower.
Yeah. Oh.
But again, it's mad rare though.
Yeah, no, I guess they would manage with medications. You'd get like some medication of some sort.
Proper steroids and antihistamines for a long time.
And then just jump into that shower and drink that water.
I wouldn't mind being special and rare, but allergy to water.
That's a crazy one. Yeah, that's a crazy one. That is, and then we've spoken about allergies at any age, right? So allergies can develop at any age. So don't ever come and say, oh, I grew up touching water and then today I can't do it. Obviously, I don't wish that upon anyone because it's a terrible one. But yeah, generally, that's the first fact. Right, that's there. Allergies can develop. As I said, I'm 30 years old now, and I've developed allergy to being scratched.
That's very strange. Like, when did this happen?
Bro, literally this year. And you know what's mad? If I scratch myself,
it doesn't happen.
It doesn't happen.
I think we should run an experiment, like off-cam experiment.
You know what? My mom was like, "How did you discover that?"
How did you discover this, Dr. Michael? Ooh.
I was with my friend, and then I grabbed something from him, and then this is the story that I'm going with, by the way. And then he accidentally scratched me, and I was like, "Oh, look at that!
Hives after you just scratched me."
Oh my goodness! Yeah. And then from then on, and then I tested it out on a couple of other people, and I saw that this is the truth.
We should really.
I'm standing on that story.
We run this experiment
of scratching.
Yeah. Let's get like 3 people to scratch you in different places.
Different places.
On your arm, here, and here. And then
then we see who I react to first.
Yes.
You'll be mad if like I react to one gender and then I don't react to another.
And obviously in this case it would be you can only react to the male gender. Since your male friend
since I'm Ndebele. Since I'm Ndebele and that. Okay, and what's the next one? Do you have a next myth and a fact?
Nah, it's just that interesting fact about allergies to water.
Oh, okay. All right. There's a myth. People believe that allergics can treat any allergic reaction. Wrong, right? Obviously. We just talked about how we use adrenaline and sometimes we use hormonal therapy to treat it. So obviously, that's that, right? Next question. How is climate change making allergies worse?
Makes it harder to anticipate them.
Right.
I.e., you would assume in Botswana, June, July is winter, and then now it's just cold in January, February.
Oh.
You see what I mean? It's like shifting the goalposts.
Yeah.
I don't know. It's. I think do the best way you are.
Yeah.
Climate change being such a global thing, I think if everybody can do their part
Yeah.
in the little own community, eventually we can make global impact.
Yeah, yeah. So it turns out that the CO2 that's been released, right, from like the global emissions, increases the pollen in the air inversely, right? So what happens is that the autumns are getting longer, the spring is also getting a little longer, and that increases like hay fever and things like that. That was a shocking thing that I found out.
CO2 and pollen.
Yeah. Yeah, it's quite
I would have
literally. The fact
never
was,
thought.
rising CO2 levels are increasing pollen production and extending allergy season. Can you imagine? You know how terrible that is, eh?
And then you still want to bring 10 new life forms.
Oh,
To
that
give
one.
us more climate change.
Don't get me started, dog. Yes, definitely. I think we need more people with strong Ndebele genes to propagate.
I was really thinking I had you with the climate change chat. Yeah, but clearly being Ndebele makes you immune to everything.
Yeah, being Ndebele makes you really strong. Shout out to my Ndebele people. All the way from Jakalas to, do you know what I mean? Bulawayo.
You had a shout out, by the way, from Zandile Sia. She is a huge fan of how unhinged you are. Literally said, tell Dr. Michael never to change.
Hey, shout out to Zandile as well.
I'm
We
the
were
one
like
that has to deal with this.
Yeah.
But for your entertainment, you know?
Do you know what
Doesn't matter how I feel.
Zandile we went to school with, isn't it?
Nah.
No? Oh, well, shout out to Zandile anyways. The Zandile that we went to school with also gave me a shout out as well. She just hit me up as well. She's like, yo, what's good? I love that stuff.
We need to get your security detail. You're like slowly on your way to like celeb status.
Do you know what? That would be so lovely. I'd appreciate it. But I appreciate all the shout outs. Shout out to Zandile. Shout out back to Zandile as well. I hope she watches this episode and I hope she learns a lot about allergies. That's about it.
Yeah, pretty
Honestly,
much.
we're going to close up. Thank you guys for listening. Thank you. I hope that this was educational and also at least fun to listen to. I don't know if you have any last remarks about allergies.
Find a doctor, hopefully one that you like or is good at what they do.
Yeah.
And because it's going to take some time, like pay detail to every little thing.
Right.
Like be as pedantic as you can about finding the root causes of things.
Yeah.
Because sometimes with patients, they tend to do that thing that you don't like, cheating on doctors.
Yeah.
I.e., I go see Dr. Michael with this allergy issue and we're not making progress, and then I decide to just switch to another person.
Yeah.
And now like there's blocks of history that aren't completely put together.
Yeah.
So I would say as soon as you see something abnormal, just go to the doctor and have the conversation about it.
Yeah, definitely.
Allergies are real. Allergy lives matter.
Allergy lives matter. You're right.
And shout out BDU.
Shout out BDU. Shout out to Kalafhi. Shout out to our hospital, by the way, and our clinics. It's going to be open in Main Mall for free on Saturdays. I think that's an announcement that we need to make people so they know. Yeah, so Saturdays you can book a free appointment. We're doing this to help. We know the situation is dire. We know a few weeks ago the president declared a public health emergency. So we're doing our bit to help. I hope that everybody else comes out and tries to do their bit to help as well.
For sure.
Let's go out there. Let's make sure that patient lives are saved. That's what's important at the end of the day. Yeah. So that's it, guys. Thank you so much for watching till the end, those who did. I want to just make a quick disclaimer. One of the producers is sleeping here. It's like, guy's having a sweet time. I wish the camera could turn around. Okay, sorry. I'm not allowed to say that. Okay, then. Goodbye, guys. Thank you so much for watching. We appreciate it. You guys have a nice day.